a doubling in the past 5 years of the penetration of cell phones, and it's estimated that the ownership will reach 350 million this year. So the train has left the station, as they say. And it's working for commerce, for banking. You know, if the banking people can overcome the issues of privacy, security, confidentiality for their data, bloody hell, you know, we can too. So let's go. And the potential to really transform outcomes at a very rural area, a very rural level, with being able to, for example, deploy emergency transport in an obstetric emergency at almost no cost, could really change outcomes. So there's a willingness to pay. There's a deep excitement about technologies out there. So that's not a problem, but there are some other problems. There are increasing numbers of technology graveyards out there because often the folks, you know, again, that little set of vested interest groups out there, they each drag in their own favorite sparkly, jewel-like technology, and it dies an unnatural death, or a natural death, I guess, because it really isn't relevant to the health system. It's not integrated. So a little bit about the power of information, and then we're getting close. There has been, I think, a very encouraging increase in recent years, which we like to take some credit for at HMN, for having an increasing number of strategic plans and assessments and plans of the information system, and we've helped countries to mobilize more than $1 billion now in support for their information systems among the 85 countries that are using the framework. There's increasing evidence, and this is where we need to, I think, the research that I see being reported over the next couple of days, I think, is a very encouraging source of all of this, the research and evaluation. But it's clear we need more of it. We can show that not only can information be used to strengthen the system, and by holding reporters accountable for reporting, you can improve reporting completeness. That's just one of a jillion examples. South Africa's managed to reduce stockouts and make sure the drugs are where they ought to be at the time they ought to be there. That we have data from Belize, which has a very strong information system that they can save money, cutting costs of their pharmaceutical management by more than $1 million in a quite a small country, within the 12 months after introducing a new management information system. And Mali has managed to reduce the cost per fully immunized child. Sierra Leone has successfully increased the proportion, and damn it, if Sierra Leone can do it, anyone can, successfully increased the proportion of women who are delivering in facilities, and while we don't have the health impact of that documented, that has undoubtedly, or will at least eventually, save lives. Belize has managed to, with a sort of decision management system, improve the proportion of folks who are managed appropriately as outpatients, and also they've managed to increase the proportion of HIV-infected women who receive PTM-TCT. And Tanzania, this was an important study as well, had showed a reduction in infant mortality with really just empowering its district health managers to better allocate resources with better information. So the globe is starting to get it. There is massive and growing demand from countries, and I think we have expanding evidence that information both saves money and saves lives. But we need to continually build that evidence base and add to the commitment. So And back to the integration, we can do more, because the power of being able to, as I mentioned before, put individual records together in a powerful way and start to pattern read will be really important. But as we know, the privacy, security, confidentiality barriers, and it's probably not those that are really the barrier. It is my prejudice, I'm willing to risk, again, being thrown out of my labor union, but that health facilities and private practitioners treat medical records as proprietary. They have no desire whatsoever to move toward these patient-held, patient-controlled systems, nor do they particularly want to encourage much portability, because the loyalty of your patient depends on that massive inconvenience associated with trying to get your records out of her or his hands. There's a lot of room for getting this better. This I thought was just amusing because the U.S. Centers for Disease Control, I stumbled into these folks day before yesterday in Washington, are, really have this vision of a grid in which they're going to kind of pull in all the individual health records and begin to really transform public health. And I think the hope of that is good, although the barriers within CDC are larger than elsewhere, again because there are disease-specific special interest groups that want to maintain their own vanity surveillance systems for their own private diseases. So there are barriers in many places to saving lives. But I think there remains a really powerful opportunity to begin to pattern read across administrative boundaries, pattern read across special interest groups, and really show that integrating information does help us save lives. I think infectious disease is one of the areas in which that's most dramatic. We've got emerging evidence that better pattern reading about malaria has started to improve our ability to prevent and treat malaria more effectively. And the diseases that are eradicable, such as polio, I think one thing we will find is that as the prevalence incidence of those diseases goes down, the ability to detect and record cases becomes all the more important. That was certainly well documented with smallpox. Smallpox eradication is often credited to the ability of the global community to track and pinpoint little clusters of cases and target resources appropriately to eliminate those. Onchocerciasis control, which causes river blindness, is another example of a disease that is being, I think, increasingly eliminated with better information. Oh, the Uki picture. Sorry, I'll carry on. The the dracunculiasis or guinea worm is another one that is being tracked. And this, yes, this is the mass scrotum. Is lymphatic filariasis is another disease that is increasingly being, I think, eliminated with the power of information. So we're back to pain. The money always surfaces. So people do recognize the power of information. I think I was laughing with my fellow female informaticians before this that jewels, sparkly things are fun to buy. And unfortunately, developing countries are getting a little angry. One of the things we heard in Rwanda is that they've had it. They've been buying things from all these guys, and it really doesn't work. They end up with things that have been promoted by both our NGO communities as well as by those folks who are selling the private for profits. And and these guys, of course, have a vested interest in, as our academicians do, in career development. You know, we like to wall off our private projects because it's important in order to be able to write papers as well. So it's not just a matter of those pesky profit makers, but the countries end up with with systems that often don't talk to each other. This is my architecture matters slide. And so the important thing is that what is implemented with regard to information systems needs to be function driven and not gadget driven. And so I think it's up to us as the informatics community to really make that happen. So partnerships matter. These are my cylinders of excellence. So I mean, we especially in academic institutions love to talk about centers of excellence, and it always makes me think of silos. So we have some things to overcome in order to be able to make collaboration possible. I think one thing that you heard me imply before, but I will say again much more directly, is that each of the components of a health system, not just the information system, each of the components of a health system here, whether it's managing services or trying to get people where they're supposed to be at the right time to provide services, whether it's tracking logistics with commodities and medicines, or managing a financial system and the financing of healthcare, or even just holding people accountable, this leadership and governance piece. These are the components of the health system that WHO has identified. And I'm sorry, every one of them is information driven. And if you don't have the information right, none of these things are going to function. So information is in fact the wiring that allows you to make the system work to deliver better outcomes. And I think, the country ownership, I'm also, as I say, amused by this dialogue about country ownership that's was even just, I came from a Institute of Medicine National Academy of Science meeting in Washington yesterday, and the country ownership they're obsessed with. Well, sorry, but if you don't own the facts, you can't own the problems, and if you can't own the problems, you don't own the solutions, and then being held accountable for delivering those solutions in a responsible manner is also information driven. So I think it's up to us to make sure information gets used as a hammer if need be to get stuff done. I think there are plenty of examples of outcomes that can be improved. I see it all happening in the presentations that have already taken place yesterday in the pre-conference workshops, and also over the next couple of days we'll hear more about this. But most of what we need to do needs the hammer of information to make it happen. So it's really up to this guy to shape the systems and use the facts. I like to think of informatics as the nervous system. But hopefully it's not just the wiring. It's not just those peripheral nerves. It's, if you'll forgive me for a minute, that brain. We've got to also be the consciousness of where we're going. The conscience that we're doing the right things. And, I won't talk about whether we're the soul as well, but, we've got larger responsibilities than just the gadgets and the wiring. And, just a final image to sort of crystallize our thoughts here. Not that I would liken the informatics community to the rat here. I think that's not a risk. I think the larger risk is that we could get identified as the ones who painted the line and fail to realize that we need to change some things before we cast health systems into stone with our information systems. We need to ask much more fundamental questions about where those systems need to go. There we go. All right, I look forward to discussion. I think we've got